All right, let's jump right in. Today, we are diving deep into the high-stakes, high-pressure world of emergency medicine. We're going to take a look under the hood at a protocol designed for one of the most intense situations imaginable, dealing with a crashing patient. So, picture this. You're in the back of an ambulance, sirens screaming. Your patient's body is starting to shut down. They're crashing. That's the term they use, and it means exactly what it sounds like, a total catastrophic failure. In that moment of absolute chaos, what do you do next? Well, it's not a guessing game. There's a plan.
Okay, so before you can do anything, you first have to recognize that you're even in a crisis. And this isn't just some vague gut feeling that things are going south. Medics are trained to look for a very specific set of clues that tell them the body is tipping over into a really dangerous state of shock. At the very heart of a crashing patient is a condition called shock. And a good way to think about it is, imagine your body's circulatory system is like the fuel line in a race car. Shock is what happens when that fuel pressure just completely bottoms out. Your vital organs, your brain, your heart, your kidneys, they suddenly stop getting the oxygen-rich blood they desperately need to run. If you don't fix that, and fast, the whole system just fails.
You know, what's really fascinating is how these signs tell a story. A super fast heart rate, or tachycardia, that's the heart just hammering away, trying desperately to make up for that low pressure. Altered mental status, that tells you the brain isn't getting enough oxygen. You've got delayed capillary refill, that's when you press on a fingernail and it takes more than 2 seconds for the color to come back. That shows the whole system is pulling blood away from the skin to protect the core. Every single symptom is another piece of the puzzle.
So while the medics are jumping in to treat all these signs, there's a parallel investigation going on. They have to figure out why the patient is in shock. Is it massive bleeding from an injury? Is it a huge infection causing sepsis? Is the heart itself failing? The patient's history, the scene, everything provides clues to solve this life-or-death detective story.
So once shock is identified, the response has to be immediate and it has to be methodical. This is where having a clear protocol is so critical. It's how you impose order on what would otherwise be a completely overwhelming, chaotic situation. It makes sure the most important things happen first, and they happen right now.
And this initial plan, it's just a masterclass in efficiency. They start resuscitation immediately, no waiting around. They call for backup because you need more than one pair of hands for this. Then they get what's called a large bore IV or IO access. Think of it as opening up a super highway to get fluids and drugs into the body as fast as possible. And at the exact same time, they're hooking up a cardiac monitor and getting a 12-lead ECG. This gives them a detailed picture of the heart to see if a heart attack is the bad guy here. It's all about stabilizing and diagnosing all at once.
And now we get to it, the single most important decision point in this entire protocol. Literally everything that happens from this moment on is decided by one number. This is what we'll call the blood pressure crossroads.
And there's the number. For an adult, a systolic blood pressure, that's the top number, of less than 90, well, that's the clinical definition of severe hypotension. Hitting this number, or dropping below it, is the trigger. It's the red line. It sets in motion a very specific, very aggressive chain of events.
This here perfectly illustrates that fork in the road. The protocol actually gets even more specific. If the blood pressure is dangerously low, we're talking below 70, or if those clear signs of shock are there, you go down one path. If the pressure is a little higher, maybe between 70 and 90, and the signs aren't quite as severe, you go down another. The patient's condition literally dictates the entire game plan.
All right, let's look at the tools medics use to fight back. Depending on which path they were forced down at that blood pressure crossroads, they're going to deploy one or maybe both of the main weapons against shock: IV fluids and these powerful drugs called vasopressors.
Okay, first, let's follow the most critical path. The patient's systolic pressure is below 70. Their body is losing the fight, and there is absolutely no time to waste. This situation demands the aggressive approach.
And what an approach it is. This is a full-on, two-pronged attack. They don't just pick one tool, they use both at the same time. They start pushing a powerful drug, epinephrine, to chemically squeeze the blood vessels and force that pressure up, while simultaneously flooding the system with a big bag of IV fluid. The goal is simple, it's clear. Get that systolic blood pressure back up to that magic number of 90.
So let's talk about this push-dose epinephrine. This is not the same thing as an EpiPen for an allergic reaction. No, this is a very specific, very precise mixture. Medics actually take 1 milliliter of the standard cardiac epinephrine and mix it with 9 milliliters of saline. This dilution lets them give small, controlled doses every few minutes to carefully and quickly nudge the patient's blood pressure up without sending it through the roof. It's a precision tool for an incredibly dangerous problem.
Okay, so let's back up to that crossroads and take the other path. In this case, the patient is hypotensive. Sure, their blood pressure is between 70 and 90, but they're not in that profound circling the drain state. This allows for a slightly more conservative strategy, the fluids-first approach.
The logic here is beautiful in its simplicity. Try the easiest intervention first. Can we fix this whole problem just by adding more volume to the system? So they'll give a rapid bolus of fluid, then they'll stop and they'll reassess. Did the pressure come up? Great. But just as important, are there any signs of fluid overload? Because if the heart is the real problem, dumping in more fluid can actually make things worse. If the fluids alone don't work, then and only then do they escalate and start that push-dose epinephrine. It's a very deliberate, stepped process.
As we start to wrap this up, it is so important to understand what a protocol like this really represents. It is not just a rigid checklist that stops people from thinking for themselves. It's the exact opposite. It's a lifeline.
And this quote, man, this really gets to the heart of it. A protocol isn't there to restrict you. By giving you a clear, evidence-based roadmap, it actually frees up a medic's mental energy. Instead of wasting precious seconds debating what to do first, they can focus on their patient, watch for subtle changes, and actually manage the chaos. Structure creates speed, and in these situations, speed saves lives, period. And that really leaves us with one final thought. The principles we've seen here of imposing order on chaos with a really well-thought-out plan, that can apply to pretty much anything. So the next time you're facing a high-pressure situation, maybe at work or just in life, think about it. How could a structured plan give you the clarity and speed you need to come out on top? Thanks for joining me on this one.